We're just checking if you can hear us, Stephanie.
That was good, thank you.
Thanks.
We've got, who's that 4020? Oh, hi, could the person ending 4020 please identify yourself?
Hello, it's Inspector Lisa Fletcher for the RCMP and Nanaimo Detachment.
Wonderful, thank you, Lisa.
Change that number to your name.
Oh,
Three little dots and then rename.
We have late items of the,
Yes, we
you're just going
have.
to read them off to me?
Sure, we have one late item that I'm aware of. We're adding correspondence from Diane Varga dated July 21st regarding the situation for Nanaimo renters to agenda item 6B.
6B?
6B. And that's the Nanaimo rent bank report.
Can the person who's identified as calling you someone let us know who you are? Is that Lisa Murphy?
Yes. Yes,
Wonderful.
and I'm gonna have to go on actually on a Zoom call. Can I call you back?
Let's see, I think, are we going to lose quorum without you? Let's see.
We don't have quorum yet.
8285 is
I think Lisa Murphy's here too.
Karen, I'm
Susie's
sorry.
here.
Who said?
So,
8285.
Yeah.
This is Sydney.
Yeah. Bring more boxes to it.
and then calling user 1 is Lisa Murphy.
Okay. So we do have quorum now.
Good.
We have 6 people here.
So we do have quorum now. I'm not too sure who it was who said they needed to leave. Was that Lisa Murphy?
No, I'm here.
Okay.
That was it. Hi.
Okay, perfect. Okay,
So we're ready to go?
we are ready to go.
Yes, we're on.
Okay, we're going to get started, and good afternoon and welcome to the July 22nd Health and Housing Task Force meeting. I'd like to first recognize that we're on the traditional territory of the Nanaimo First Nation. Today's meeting of the Health and Housing Task Force will be held in accordance with the Community Charter, Council Procedure Bylaw 2018 number 7272 and Ministerial Order number M192. Therefore, members of the public are required to observe meetings virtually and not attend in person. Question period will be suspended throughout the duration of this order being in effect. Members will attend via Zoom at these special meetings, maintaining physical distancing at all times, and members of staff that are partaking in the meeting will be spread out in the boardroom. Are there any late items?
Yes, so for agenda item 6B, Nanaimo rent bank report, we're adding correspondence from Diane Varga dated July 21st regarding the situation for Nanaimo renters.
Thank you. So I'll be looking for an adoption of the agenda with that addition.
Councillor Hemmons, and seconded by anybody?
Who's good?
Is someone able to?
Thank you very much. We're not going to get very far if we don't have this. Okay, all those in favor, say aye or hold your hand up. And any opposed?
Hearing none, that's passed.
We need the adoption of the minutes. Stick around, Jason, by Councillor Hemmons, seconded by
Jason, thank you very much.
all those in favor, raise your hands, you say aye. And any opposed?
That's done. Thank you very much. And now we're on to presentations. And it's Kelowna Journey Home Partnerships and Implementation. And it's introduced by Lisa Boltelsey.
Good afternoon, everyone. We are very pleased to welcome both Sue Wheeler, who is with the City of Kelowna. She's a social development manager, and Stephanie Ball, who is with the Central Okanagan Journey Home Society, the executive director, to share some of the lessons they've learned through Journey Home that I think apply very well to where we're going with our systems mapping work in Kelowna. And one of the things I'd like you to pay attention to is some of the next steps that we may wish to consider as a Health and Housing Task Force in terms of recommendations to Council. So without further ado, I will hand over to both Sue and Stephanie to provide their presentation.
Good afternoon, everyone. And thank you for inviting us to present virtually with your community today and your community theater. We are presenting from Kelowna, and we'd like to acknowledge that our space is the unceded and traditional territories of the LECOH Okanagan people that we are joining you from today. And as you can see, we have a bit of a screenshot of our beautiful valley in wintertime. Looks even lovelier today. My colleague Sue Wheeler and I are here to give you a bit of a 30,000-foot overview of some of the processes that informed our work along the strategy development here in our community a few years ago. And it's important for us to mention that when Kelowna was building our strategy, we reached out and received a lot of mentoring and information from a number of cities across Canada. And, you know, part of that reciprocity for us is to be able to take up opportunities like this to go on and share what our learnings to date have been and how we took what we learned and implemented that as part of our work. So moving along on the slide, please. The Journey Home strategy is really about some foundational concepts and some key goals that we're working to as a community. So on the next slide, we talk about our three key goals as strategy, and it's part of the work of the society specifically to keep that work mobilized. And of course, our key objective is in putting an end to chronic and episodic homelessness here within our community. And within that, introducing the measures that prevent homelessness in the first place, which we know is a whole different conversation around poverty lenses and social equity, but also looking at how we implement a coordinated systems approach to homelessness, recognizing that when we talk about the homeless serving sector, it's not really a sector, but rather a community of services and supports that people touch upon when they're journeying through the experience of homelessness into housing. So those are the three key goals and visions of what the strategy looks to achieve in our communities. And within that, we look at the foundational concepts around innovation and risk-taking and trying things that we haven't tried before, in reconciliation being a very guiding lens to the work that we do, and recognizing that our role as a non-Indigenous organization is to ensure that as we learn and develop strategies for Indigenous community members, that we do so with the right worldview and with the right guidance. And always being informed through a lived experience lens. And that was a very intentional piece around the Journey Home strategy and its development, was that the understandings that we take and the systems that we design and the solutions that we find always need to be from a user design, recognizing that people journeying through homelessness accessing support often face a lot of systemic and perceived barriers to access, and ensuring that the essence of our work stayed true as we moved along in developing the strategy. One of the other things we noticed, and I'll just mention this on the slide, is that we use a lot of visual representations of our concepts in developing the strategy and in our ongoing communications about the work that we do. And we found that it seems to be very helpful and key in having the strategy and the key pieces really resonate with people when we're out engaging community and other partners around what it is we're doing and what that looks like. So moving on, our presentation topic, we were asked to talk about a number of different themes, and you know, from where we've journeyed in a short couple of years, each one of these could probably fill up a good 45-minute slot. But what we're going to do today, rather than deep dive, is just express some of the processes that we went through in looking at building a foundation for a systems approach. The processes around what we identified as game changers, around lived experience voices, around developing an Indigenous voice to our work, how we engage private sector, research partners, and then talking around some other pieces that we were asked to provide some learnings in the work that we're doing with peer navigation in our community, the role that Interior Health, as our health partners locally, play in the systems that we have and the systems that we're evolving to, and then a little bit around our complex needs advocacy project that's currently being mobilized as a community. Next slide, and over to Sue.
Thanks, Stephanie. So our understanding was that your committee was really interested in learning about the work that we did around readiness and getting the community ready to develop the strategy. So the next few screens are going to touch on that. And I'd also like to say, I know you're working with Alina Turner, and Alina was the consultant we worked with that guided us through the development of the Journey Home strategy, so that's pretty exciting. And so this screen is really just talking about what we had to do to really prepare the community to shift towards a systems thinking approach. And in terms of a systems thinking, that's where everyone starts to understand that their organization is part of a greater collaborative that's all supporting the same client, rather than looking through their own lens and just the clients that they support, understanding that the people they're working with are actually the clients of the system. And I was remiss in adding that a big piece of this preparation was really based on a research paper that Alina had published beyond Housing First, essential elements of systems design approach in ending homelessness, and embedding those 7 essential elements into our work was key. And the tool that we really believed would be effective in using to apply this work was through a collective impact framework. So really forming that common agenda, starting to measure overall as a community, and a really key part of that is to have a backbone of organization that's supporting the work. So if I can just get the next screen. And the next screen skip one. The next screen shows the framework that was developed and presented to council early on in the process. And what you can see here is I just wanted to briefly show you what the first 2 parts of this phase were about getting the community ready, the service providers ready to work in a collaborative fashion. And that was before we even formed the task force, which was in phase 3 when the task force was formed and the development of the strategy started. So I'll just go to the next screen to talk about key piece of work. I forgot about this one. This one is just a visual. It's from the St. John System Client Framework that I believe Alina worked on also, that really demonstrates the complexity of the homeless serving system and how many different areas of services are actually engaged in this work, and starting to understand that all of those services are what people need to navigate through to address their housing needs. And then taking a stand back and looking at the homeless serving system is actually connected to many other systems, and really understanding that is key in this work. And the next screen is, so shifting to the systems thinking approach. So what we did early on before we even made the decision of what the governance model would look like for our task force, we hosted a workshop that over 100 people attended to talk about systems thinking 101. And we hired Org Code to fill that workshop. And we worked really hard to ensure that every organization that attended, they brought all layers of their organization, right from frontline workers to managers to the AEDs and the leaders in those organizations, because to embed this thinking of this, starting to move to a systems thinking approach would take all levels of an organization to understand that and embed change. We did a lot of education at this workshop, but we also did some really fun interactive exercises that really demonstrated to people that they needed to see themselves as being an interconnected system. We also spent some time talking about what a systems approach was, and the fact in a systems approach, what you are encouraged working, but it's to look internally, and if we each look internally at our organizations and where we might be unintentionally creating barriers to problems, that's where change starts to be created. What I would say is that conversation was transformational. People started to see their work differently, and we see the results of that today in how closely and collaborated and coordinated all of the work that is happening. And I think Stephanie might touch on the COVID response later on, but that was a real strong demonstration through the last few months and the work that we've done. The second day we brought in the workshop, we brought in all the leaders of the organizations and talked about best practices and moving forward and how we can move forward to form this strategy in our community. And one key conversation was who would be the backbone. And so they asked the city to take that on, recognizing the city wasn't in that sort of competitive nature that had developed over many years of the caused by many years of traditional funding models where organizations had to compete for resources and didn't necessarily open up to working collaboratively. So we stepped in as the city to take that role, and then again through the development of the strategy that Helena led, it was a lot of discussion around who would take the backbone role going forward for the implementation. And hence we have a new organization that Stephanie represents, the Central Okanagan Traditional Society. And I just put this up just to reiterate that, having a resource that demonstrates when you're trying to talk about something that's really complex, having a resource that is visual and easy to follow. And so Alina created this for our community, and we've used it in educating people that are working in the system and people that are just wanting to learn, maybe funders, etc., to understand what we mean when we're talking about putting adults together to create our homeless service system locally. So I won't go into detail, but it's been a phenomenal tool.
And with that work that was undertaken as part of the strategy development, and as Sue alluded to, there was a number of partners that came to the table. There was a really intentional approach of bringing together new and different perspectives and what we call the unusual suspects in our world, which is, partners like the tech-serving sector, or the faith community, and other organizations, developers and landlords and funders and local private philanthropic groups and individuals. And it's been a real game changer in terms of our ability to mobilize different opportunities and innovations in our community. So one of those included the forming of our lived experience circle on homelessness, which we call LECOH, which continues to advise and drive not only the strategy, but the work that happens in communities, in community operating services. The research partnerships that we've created that have enabled us to have a local consortium focused purely on research around homelessness, but from a more developmental, learn as we go and pivot as we go research lens rather than a traditional academic lens. We've been able to mobilize technology in new and different ways, and some of that has been as recent as our COVID response in looking at an outreach app to enable us to stay engaged with people out in the community. So across the community voices and the 2,000 people that, or 2,000 points of contact that we had a lot of bringing together of community partners in ways that we hadn't done before and that a lot of communities hadn't done. We had a couple of community summits along with 23 hosted design lab conversations, which started with, learning where we are as a system, discussing what's working and what isn't, but really focusing on building an optimal blueprint solution. And many of the blueprints that were mobilized through these conversations have been implemented. So some of those include, like we said, the lived experience voice, the research and tech sector. We've had an interest-based community table set up that's been involved in mobilizing resources and funds funds when we needed that to support the sector. It's enhanced our ability to support youth homelessness in a different way. We have Away Home Kelowna as part of our work, and the youth homelessness strategy was very much embedded into the Journey Home strategy. So that enabled us to develop a lot more prevention and diversion work around youth homelessness, including some recent projects and partnerships, youth upstream projects, and some work under the federal Making the Shift. Having a community-driven strategy in this sense with the additional partners has really been pivotal for us in how we mobilize the services and resources and public policy conversations that you don't typically have when you have the immediate players at the table, which is usually funders and operators. So a lot of the work that has carried on since the adoption of the strategy 2 years ago is really very much coming out of the conversations that we had through these design labs and community-driven solutions and ideas. Moving along, please. Over to you, Sue.
Yeah, sure. So I would say that when we talk about game changers in our community, the lived experience or homelessness that was developed throughout the strategy has been one of our biggest game changers. Now, a key part of processes when we're doing this work is that there's a lived experience voice at every table and in every piece of the work. So we started out with the strategy development being very intentional that we would include lived experience voice at our task force in a decision-making realm, and that we would have a really open and inclusive process for people with lived experience to input. But the key was we were intentional in the fact that input during the development of the strategy. It was about ensuring that there was a mechanism to really ensure that lived experience voice participated in the implementation, not only the development, but the implementation of the strategy in a very strong way, and that they were embedded in all governance structures that were developed throughout the strategy and after the development of the strategy. So, for example, they are a voting member of the Central Okanagan Journey Home Society now. They also have a table with the terms of reference that is providing ongoing input and planning to decisions in a number of ways. Sometimes they do a skills inventory and select members to sit at different community tables and bring their voice forward. But they also, something that's working very well is they have an opportunity for service providers or decision makers to come to their table to engage them in discussion about key decisions in the community. So for example, bylaws will take some thought processes that they have on working with the people that are sheltering outside. And this group actually helped us plan what our designated outdoor sheltering space would be, look like last winter when we had a need for that. Their three focus areas are that they represent voice of people without homes. They are committed to ending discrimination and stigma, and they're involved in several different projects there. And then a key focus of theirs is to support peer empowerment and mentorship. And that, I'm going to talk about that a little bit later in the presentation a little bit more. And this is just to give you a sense of some of their work. So we were engaging, Journey Home was leading a conversation in the community with the city as a partner around what the future of shelters should look like in our community. And so we started with the lived experience circle, and they went out and conducted focus groups of people that were actually experiencing homelessness at that time in shelters and drop-in programs, and those that were sheltering outdoors. And they had a conversation that actually led to the development of these four key elements or components that they brought and presented at the beginning of the shelter design lab that we hosted. So choice, safety, healing, and community. And each of those have deep meaning, and we have a whole series of information about what each of those elements bring to the table. That conversation that began was maybe a little bit, controversial, so word, but when this was presented by our lived experience circle, I would say the whole conversation changed, and people found it to be so powerful. And it's actually a lens for us to use to look through all of our services, and when we're looking at supportive housing and what it offers people, etc. So it's been quite interesting to see this unfold in a very powerful exercise for sure.
One of the things that wasn't included in the committee's ask around our presentation was to where reconciliation and Indigenous worldviews fit into our planning. But we thought we've had so many transformational conversations around this with community partners that we thought that's just a little bit of something that we wanted to share as well. We certainly know in the context of the work that we do nationally, the Indigenous voice is critically important to what we do, and we feel that even more strongly in the Kelowna area where we recognize we are working on unceded land. Reconciliation from the early days was woven into every community conversation. It was one of the foundational concepts of the strategy that was developed by community, and it was a conversation piece that was woven into every design lab and every focus group that we had over the time that the strategy was being built. We've taken a lot of teachings and guidance through the work that we've learned in the development of the strategy and looked for opportunities to embed Indigenous worldview into our strategy, but also recognizing where our role is to take a step back and be guided and advised by our community partners around what services and supports and housing needs to look like from an Indigenous worldview going forward, and recognizing that sometimes that may look very different to the way that the base of the strategy was built on a broader community sense. So very intentionally in the work that we do, we work with we work alongside Indigenous community partners to ensure that there's continuous voice in the development of the work that we do. We work operationally, our organization with other partners, taking the lead where we're at, and also taking an allyship area and view when we're asked to do so as well. So with the next slide, it's been transformational in how our perspective of how we design systems in a broader way have rolled out. It also changed the way that we see problems and solutions from a generalized systems lens. And I think one of the key learnings I've seen in many jurisdictions is an awareness that an Indigenous lens is very much about a whole person. And I think if we design systems and services across communities and across nations from a whole person lens from the get-go, we probably wouldn't have as many systemic challenges as we do, not only in our community, but in others. In terms of how we mobilize that into housing and supports, we're still very much at the beginning as a community. We're still looking at overall development as well as supporting organizations that are looking at specific housing projects that incorporate cultural supports and are formed very different from some of our mainstream supportive housing models. When we talk about reconciliation, thank you, we still look very much at ways to more intentionally embed an Indigenous voice in our work. I say we're very much at the beginning. I'm happy to share my board has always had a seat on it for a community member who represents Indigenous voice. And recently we've struggled to have someone take up that spot. And when we had a lot more exploratory conversations, part of that was because we want to support organizations who attract funding, and sometimes there's a conflict, but it was also a recognition that, through an Indigenous lens, people don't change systems and change circumstances through sitting at governance tables. And that was a real key learning for us in how we need to engage partners differently. And we've taken those work and those relational pieces much more to an operational level in the work that we do across the community, supporting the development of a potential community advisory board for homelessness that is Indigenous focused, looking at the development of an Indigenous caucus in our community, as well as supporting local new providers within the Indigenous housing realm getting established and finding their feet within our community. The Journey Home Research Collaborative, as we talked about, that was one of the main pieces that came out of some of our earlier work. We've had some incredible partnerships form out of this, well beyond our post-secondary partners, but it was really interesting because this was the first ever formal partnership between UBC Okanagan and the college here. And researchers locally, as well as other partners, I believe Alina's connected to that group as well, have committed to collaborating on participatory community research that's aligned to our strategy. And it's been a great opportunity for us, particularly in situations like COVID, to be able to hone in and learn and analyze, if you will, the work that's carried out throughout the communities, and not only look at it from a research lens, but also tying what's taken from those learnings back to what people with lived experience of homelessness are saying about the impact of how we plan systems in our community. It's been an incredible opportunity to develop new innovative ways to analyze our own internal systems, and down the road we're hoping to be able to publish and share more of these learning broadly throughout the community. There's been some collaborative funding opportunities that have come out of this, and very recently through our COVID response, our lived experience circle and our research collaborative group were able to marry up on a project that was sponsored by BC.
So this is one of our success stories out of our strategy. Early on, our lived experience circle indicated they had a vision that there would be a peer mentor that would be the first person anyone looking to access services or going into an agency, the first person they would meet would be a peer that would support them in accessing those services. And so it's a bit of a long story, but it's through a strong partnership with our community action team, which I'm not sure if you have one in your community, but it's funded through the province, and its focus is on community response to the overdose crisis. So there was a partnership that formed between the city, Interior Health, our lived experience circle, and our Indigenous partners to develop a peer mentorship program. And what's come out of that is the People Lived Experience Society. Urban Matters is a 3C company in our community. They've been incubating this organization as a social enterprise, and I'm happy to say that earlier this year it became its own society and is operational now. They've had 2 cohorts of graduates. Over around 55 people have actually graduated from the program. There is a strong Indigenous cultural component to the overall program, and there's also an Indigenous stream where people that are Indigenous can learn their cultural practices to be able to use those in their work when they become peer mentors. So they have numerous contracts over 2019. Some were with the city, and they ranged, and with other organizations and local businesses, and it ranged from employment opportunities like landscaping, working in a factory, to actually working as a peer mentor. But I have to say that this group has been key in our COVID response. When we were looking at opening a hygiene center, when the shelters had to reduce their numbers and more people had to shelter outside, they are the people working at the hygiene center. We opened a pop-up washroom in the downtown core because there was lack of access to washrooms for people, and they operate the washroom. And they're doing mentorship in that role on a daily basis right now. It's working very well. And then one of the big announcements, we actually took a report to our council last week.
Delivery?
Sorry?
250-390-4020.
She's on the phone.
Oh, sorry. So last week we took a report to council announcing that we've received
Bay Street,
Excuse me, Lisa Fletcher, could you mute yourself, please? Thank you.
We took a report to council announcing that we received a 3-year funding through a Health Canada grant. The name eludes me right now. Substance use addiction program to develop a people-peer capacity building and peer navigator program. And the goal will be to meet legal efficient, basically. So the community is very excited about that. And that work, we're just forming our project team this week that will oversee it. The city was the applicant, and Urban Matters will be supporting the people of lived experience society to implement the activities that have been approved. And I know that you were interested in learning more about the interior health role in the Journey Home work. And so just try to lay this out to give you some information. But basically, the interior health staff have been actively engaged in all of the work around the development and the implementation of the strategy. They sat on the Journey Home task force and the transition team. The transition team was put in place with funding from the city to make sure we didn't lose momentum and the work continued while the Central Okanagan Foundation, or Central Okanagan Journey Home Society was being formed. We have a systems leaders table. They said at that we're working on a social policy framework that's really got a prevention focus. And they're participating in that. They partnered with us both financially and with resources on the Peer Navigator project. And they've been active leaders in our COVID response plan and implementation. It's been quite phenomenal. They put resources in place. We've had a vulnerable population coordinator on the ground helping navigate people that are at risk into appropriate services, etc. They've also made a commitment to a system redesign to align with the Journey Home strategy, and they're working with us on the complex needs project that Stephanie's going to tell you about. I would also like to say one of the things that I think was a real systems change with health was their recognition through the Journey Home strategy development that they had many pillars in their organization that were connected to the work, but they were disconnected in their conversations. So they formed an internal team of mental health, substance use, primary care, the medical health officer, and population health. And that team works with us collaboratively on all of our work. So it's been very, very effective.
And carrying on from what Sue was talking about, part of the work that's happening in our community, of which Interior Health is a key partner, is our Complex Needs Advocacy project. So the focus around that is a regional focus. It was initiated by the City of Kelowna. Obviously the city being a key partner, as well as Central Okanagan municipalities, Interior Health, BC Housing, and Journey Home Society. So the purpose of the project is really focused on meeting the future housing and health support needs of our region's most housing vulnerable population. We have had a number of on-the-ground interviews and engagements with community providers, as well as understanding the data that we already have about people in our community experiencing homelessness and what their vulnerability and needs look like. It's a project that will carry on over the next few months, and we hope to wrap up later this year. The expected outcomes that we can identify the level of needs of people with complex needs across our communities, as well as understanding how that informs decisions around the types of housing we need and the volumes of housing and supports that would be informed by that. Developing a strategy around our complex needs, as well as identifying opportunities, whether or not that's to redesign services or to increase the services available in our community. And looking at a UBCM resolution, an advocacy paper that can help inform decisions outside of our own jurisdiction. I don't know why I'm tapping my screen thinking I can change things. Too many Zoom meetings. Some of the other work I'd love to talk about that ties into not only that, but our broader understanding of what our trajectory looks like in ending homelessness is we recently became one of the communities in BC on a national level with Built for Zero Canada. I believe your community was exploring that as well. So in May, we were thrilled to have our first month of true quality by name data and be able to track our monthly housing move-ins as well as our inflow of people experiencing homelessness, as well as doing some deep dive data around understanding what housing placement breakdowns look like in the system and people that move within the system, but there's never an opportunity for new units to become available. And just really looking at how Built for Zero and our ability to track these key data points across the community is going to help us make better system decisions, as well as understand what services need to look like and what they need to evolve to be able to support people better, and obviously move the trajectory so that, you know, we work towards functional zero. Right now, our list shows 374 people actively homeless in Kelowna in May, with about another 160 people on our inactive list in the community right now. So we know we still have a lot of work to do, but at least now we have a quality by name list to be able to track that and, more importantly, stay connected to the people that we're serving across the community sector. And the Kelowna COVID-19 response. This was obviously, as Steve talked about, this was a really critical last few months for our community, as much as it has been for everyone else's, I'm sure. And one of the things that I think all of the intentionality around systems design in Kelowna really served us well through the COVID response. The leadership team for our community response included Journey Home and the City of Kelowna, BC Housing, and Interior Health as the four key partners to help orchestrate and mobilize the work and supports and resources that went across the Kelowna community and continue to go across the community. We did a population focus, so we looked at people that were sheltering and at risk of COVID, as well as people that couldn't self-isolate because of being at risk to themselves, and what do we do in terms of, should we need a mass isolation facility? How do we support the increase of people that were sheltering outside where we had to reduce shelter capacity beds? It's been, you know, in the face of a pandemic, it's been a phenomenal opportunity for us to do things differently. I think the common desire that we outreach everybody in our community experiencing homelessness and not leave people behind or vulnerable really gave us the opportunity to move past some of the silos and challenges that we would have typically faced, like most communities do, around data sharing and working together. So we coordinated everything from using coordinated access for people coming off streets into shelters, looking at space planning and how we utilize things like motels and set up hygiene centers, and be able to create a system and break a system and reform a system differently than Kelowna's done before. And with that, we've had a lot of conversations in the lull that we called COVID until last week when Kelowna started to be popular again. We've taken that lull to really identify some early learnings and also carry on some of the intentionality around the work that was embedded through this. And one of those examples is really around Interior Health and the way that they use the vulnerable populations working group to embed staff into shelter operations, into supportive housing outreach, into outreaching people that were staying on the streets, and now the exploratory conversations about how does Interior Health continue to play a role with these folks and with other partners as we move forward and in more intentional and permanent ways.
That have emerged through our work. Having a backbone has been critical to the work. The foundational work around having lived experience voice and Indigenous voice in our work. And I think it all comes down to, you know, in order to really coordinate and work as a community, you really have to build on the strengths and really have the courage to change. So that upfront work that we did in getting people ready for that change and really understanding how they can be a part of the change and what they can contribute
No, I think that sums it up. Obviously, we'd love to explore any questions or thoughts or clarifications that anyone may have.
Well, thank you, Sue and Stephanie, for that great presentation. I'm hoping we have a lot of questions. If we could put everybody back on gallery view. Jason, I think you have a question, and Alina's saying hi.
Hi, thanks for the presentation. In Kelowna, you guys have taken a pretty specific approach to creating that backbone organization. From your experience and learning, what have been the pros and cons in that approach relating to like outcomes of the action plan? Because it's been a couple of years at this point, right? If there's something you could share around that, that'd be great.
I think I'll let you jump in, Sue, because you were here during the development and recommendations that came around that.
Well, I think challenges are, there was an upfront commitment that Journey Home would not compete for dollars with any organization. Like that was key in the process to ensure the trust was established. We had, I can't remember the day that the strategy was delivered, we had 100 signatures on a pledge for the Journey Home strategy. So I think people were really committed to having this one organization that was going to lead them. And there was just such a need to have a neutral body in place. I think that I can't think of anything that we would have done differently. I think that the city's support in the development of the Journey Home Society was key. So the city has an MOU with Journey Home and supplies funding, annual funding of $150,000 a year to Journey Home. I think that maybe if there was a drawback, it was the optimism that such a huge undertaking could be done by such a small organization with the goal that the organization will build over time. Alina built that strategy of how it will build over time. But so there's been a strong recognition that city resources and other partners' resources have to be leveraged and that we have to work really collaboratively. So I don't think it would be a negative thing. It's just taken a while for people to get there in that realization. And so those conversations are ongoing. But, we work really closely with Journey Home in terms of data integration, in terms of communication, in terms of working on housing. We work with BC Housing, Interior Health, and Journey Home. So I think if people thought that Journey Home would be standing there on their own, that was a little bit remiss. It needs to be us all that are supported as a collaborative. But having Journey Home be the voice of the strategy is so powerful. And having it be community-driven, the community really feels that they own it. I believe that. And I think that there's many people in the community that know about Journey Home, far more that don't know. And people see it as the strategy the community develops. And I think that's been key.
Erin, do you have a question?
I agree. I think the only challenge for the society as a small organization is, the strategy and the technical report itself are really several hundred pages of understanding what needs to change. And some of those directly impact homelessness, and some of them are more periphery in the community. So it was about taking the strategy and recognizing that all of it has validity and is critical, but distilling down what the activities of the society are as opposed to the strategy as a whole, and really mobilizing from that perspective about, what can we achieve with the resources that we have as a young organization.
Erin has some questions.
Thank you. Thanks for your presentation. I'm curious, this is actually probably a question for Alina. So the Systems Thinking 101 process where you got those 100 people into a room and you talked about the philosophy of providing care or delivering services. I'm curious, and I don't know, Alina, if you've turned off your screen because you're not here, but that seemed like that was a real, that was a game changer for you. And it seems like it's part of the conversation here because we are, of course, are asking people to think differently so we can potentially find different solutions. So for Alina, is this something we can embed in our process? And if so, where would you see it fitting, or were the design labs the answer to that? Alina's not here. Okay, we'll move that to another piece. Okay, I have another question specifically for you two, Sue and Stephanie. What would you do differently?
I wasn't a part of the strategy. I've been in the sector 26 years. I moved to Kelowna in this role at the beginning of December. So I was here after it was adopted and the society was set up and operating for a bit. One of the things I would do differently in terms of aligning the work that needs to occur and the way the organization was designed is that for this kind of community work and mobilization, you need to have the resources in place to have an upscaled organization from the get-go. Whereas our society was designed to ramp up over the years, which doesn't marry with the need to really put some full-scale efforts into moving the needle on homelessness, and then being able to be a bit more turnkey in some of those critical pieces as we move on. So I think the design of the resources that it took to meet the objectives of the strategy needed some alignment and needed to change. But I think from an outsider coming into a new community and just from what I've seen in other jurisdictions, I was in Edmonton before this and Red Deer prior to that, I think the community did an incredible job in the engagement process and the totality of the information that came out of that to inform decisions.
I think we had a question from Signe on the chat regarding the size of your budget. So what is the size of your annual budget and where does it come from, funders, and how much is staff support versus grants initiatives funded?
We are just over a year old, and our current operations up until now, I think, have been sitting around $300,000-$400,000 a year. Half of which has come from or $150,000 comes from the city of Kelowna, and then the rest has been private donors. And no grants at this point in time. That is something we would explore down the road, as long as it doesn't take resources from existing community service agencies. Going back to what I just said about needing to ramp up capacity to achieve the work, I've just rescaled our operational needs. So going forward, we're more between $800,000 and $900,000 a year. About $600,000 of that will be staff. Right now, there's myself and a full-time systems planner, and then we have in-kind contribution around administration and communications and things like that. So we're looking at having our own in-house people as well as hiring a data analyst to oversee our community database around our by name list. So we don't anticipate in the next few years having more than probably 6 to 8 staff, including our part-time youth homelessness coordinator and our convener who oversees our lived experience circle on homelessness.
I have a question regarding the business and private sector. In the beginning, how were they incorporated into the plan, and what sort of contributions are they giving right now as it's being implemented?
At the beginning, and I don't know, Stephanie, if you want to get after that. So when we formed the task force, we were very intentional about bringing all perspectives to the table. There were some agency places that we knew, like BC Health and Interior Health, had to be there. We had selection committee for the task force that included Mayor, myself, ourselves and my boss, who's the head of active living and culture, and the city manager, and the two people from the community approached us to be co-chairs, so they would be the face of the strategy, and one came from more education and the social sector, and one came from business. So we wanted to ensure that both those perspectives were at the table, and then we did a skill experience and knowledge matrix of all the perspectives we wanted included at the table, which included developers and business, etc. And people applied and were chosen for what their knowledge, experience, and skills were that they were bringing to the table. And each of the people that sat at the task force, their job was to go back and educate their sectors and engage them. So when we did the design lab, when there was a design lab that related to a specific sector, that person on the task force was responsible for ensuring that we had strong participation in those conversations of the design lab. And they became ambassadors for the strategy, and they are ambassadors till today. Some of them formed the initial board of directors for the Journey Home Society. And it was them that took the message, went out to the community, did the fundraising. It was quite phenomenal. But that's what I mean when I say it was very much community driven.
And just to add to that, many of the initial kind of key community influencers that joined our board are still on the board. Some of them are investors in the work of Journey Home. Some of them donate towards community programs such as like rent supplements. We have one community member who is also a developer and is in partnership with a local provider to develop our first youth housing first spaces that should be open soon. So, I mean, community influence, particularly in the Kelowna context, is very important, but really there's always still an engagement, and certainly people that invested fiscally early on, many of them are still contributing.
One more, you mentioned that housing, who's building it and paying for it?
Some of the housing is private development, with the spaces being supported by BC Housing, and some of it is the BC Housing supportive housing development.
Okay. And Lisa?
Hi, Sue and Stephanie. Do you have like some measures in terms of what perhaps reduction or balance of the numbers of people who are unhoused, how that's shifted since you started in terms of being able to see results?
I'm going to have to leave this one with Sue. I'm going to give my apologies. My board members are just arriving. I need to go chair a board meeting. So my apologies that I can't stay, but I will leave that with Sue. And thank you all for having me here.
Thank you very much.
Thank you.
Yeah, so the Journey Home strategy has our milestones that we're working towards, and one of the goals in the Journey Home strategy was to develop 300 units of supportive housing. Just to give you an example, I think we're well over 400 units that have been developed now that will be in place by the end of the year. We have 168 units coming in the next several months that will be in place before the end of the year, and our total base will be well over 400. Many of those are supportive housing that BC Housing has worked with us on, and that's been since the beginning of the strategy. Before it was even developed, that work was underway. We also have a number of units of housing for scattered sites that are part of that equation. So I think that would be the biggest one that I would be able to share with you just off the top of my head.
Thank you.
I'm just wondering if that's keeping pace with the numbers on the streets that you're seeing.
Well, I think that what Stephanie was showing you in the Build for Zero, this is the first time we've ever had a really clear understanding of what our numbers look like. The number she shared with you is actually Lake Country through to West Kelowna. That's another thing that's happened in the strategy, a conversation that emerged through our design lab was how we really needed to take a regional approach to homelessness and ensure that as a region we're on the same page. And so that work's underway. We're working as a region and looking. So I wouldn't be able to tell you specifically how many people are actually from Kelowna from that list. But we know that our numbers have been increasing. We've seen that even through our hit count. But what I would say is that just having the understanding we have right now at the level we have it is going to really improve our ability to plan appropriately. Because, we were working off the BC Housing Coordinated Access List. I don't know if you have that table in your community, but it wasn't a comprehensive list. Through COVID, we were able to put coordinated outreach teams out in the community working. The city helped develop an app that was about ensuring that every person received a connection and a health check on a daily basis through all the coordination that was happening. And we were also able to get people connected to services and in line to have VASD, so that there's a vulnerability assessment tool. And so now this is the first time we have that complete picture, and the work that we've done with Built for Zero is quite phenomenal. There's a very low registration fee annually, and the city actually funds that registration and is a part of the table that's doing that work. So. Does that help answer your question?
Yes, thanks very much.
Are you saying we call it a point-in-time count? The city funds the point-in-time count there?
No, the point-in-time count, we're a designated community under the Reaching Home initiative from the federal government, so that's funded through them. This is different than a point-in-time. A point-in-time is when volunteers go out and they count how many people, and they survey the number of people that they find in a designated time that appear to be living without a home. The timing list is actually knowing each individual by name, their circumstances, and their level of need, person by person, and that's what we've been working for over the last year to try to get a comprehensive list and a good understanding.
Okay, thank you. If we got maybe another minute or so, I believe that Councillor Hemmings had a question for Dr. Turner there as part of this. Did you hear it, Alina, or did you want to repeat it?
Oh, no, sorry. I might have been running to the bathroom.
So my question was, we heard that one of the game changers for Kelowna was this Systems Thinking 101, where all of the service providers came together and had this, big dialogue about a philosophically different approach. So where or is it that embedded in our work? And if it's not in our work, do you see the same value? Because of course Kelowna and Nanaimo are different entities, right? So if it's not part of our work together, is there a reason for that? And if you see it as beneficial, is it something that we could embed in our process?
Yeah, so the systems, I think it wasn't systems planning 101, it was a community forum where we presented best practices and the approach to the homeless serving systems design and ecosystem thinking. So if you guys recall, when we developed our work plan and engagement process for Nanaimo, we had decided on doing the kind of the smaller design lab instead of the big community fora. So that was a decision that was made by the working group when we were negotiating the contract. And if you recall, we had initially had a big meeting where I was going to do exactly the same thing in the open house, and then that ended up getting scrapped. So it was initially in the design, but it was, now I don't recall what the rationale was for the working group to move to a more kind of a staggered approach, but that's why we ended up with all these design labs throughout the process instead. So yeah, that's the answer. The thinking was to embed it through through the process instead of doing it upfront.
Okay.
Now, all the work you guys have done, I embed all of that throughout. So the same diagram that you saw with the traffic, ours is the ecosystem one with the ocean, if you recall. So we've ripped the content over the past year with so that you guys are getting the same type of approach. It's just that, you know, the community decision was to have it in a different format than we had originally pitched as the open house. So I can't remember who or why it was scrapped early on, but if somebody remembers from back in the days, back in October, November, I think is when we were all talking about it, by all means, chime in.
So actually, I think the question might be a little bit more to Sue, because I believe in Kelowna they might have done this process not through yours. So Sue, I don't know if you want to speak to that.
Yeah, sure. Actually, yeah. So Alina did do that work. The one that I was talking about, Alina, was it was earlier on before we formed the task force. We did some readiness.
Oh, sorry. Yeah. Okay.
We have one other question from Sydney in the chat, and she's asking if how much of the $300,000 that's Stephanie's budget is from, is any of it from, can you just bring up the chat, is from the Reaching Home funds?
Actually, at this time, none of it's from Reaching Home. So that's probably one of the things that we should talk about. The challenge was Journey Home. The society hasn't achieved charitable status yet. They're working on that, and so there's been some barriers to them being able to access the Reaching Home funds around coordinated access that I think was just in the last year, a 4-year program that Reaching Home put in place. So our local community CAB actually voted that those funds should flow through to Journey Home, and because they're the lead on the coordinated access fund, but they haven't been able to access those funds yet. So I think they're hoping, sorry, I don't know the timeline, but very soon to be able to achieve charitable status, to be able to access those funds. And in the meantime, we've been flowing those funds. Well, other organizations have taken on those funds on an annual basis to do a piece of the work around coordinated access, but the community wishes those to go to Journey Home, so that's been one of the challenges right now. So in their budget right now, that isn't any funding from, other than the city funding, that's only government funding right now.
Okay. Thank you. Does anybody else have any questions of Sue while she's here? Seeing none, I want to thank you very much, and please pass on our thanks to Stephanie as well. I appreciate it. You guys look like you're making a dent, and our hats off to you, and hopefully we'll be able to catch up to you real soon.
Okay, and I wish you all well. Thank you.
Okay.
Bye now.
Thank you. Bye. So we're going to move on to item 5B now, data sharing and integration tables. I believe that Lisa's going to be introducing Dr. Turner here on this one.
Okay, so Alina is with us today to take us through the next steps, and this includes both what we've been talking about integrating things beyond the coordinated access piece and looking at that complex needs, top 50 people with high needs. And then also, this will also include an update on the design labs and where we go next with them and our timing around that. So without further ado, over to Alina. You're on mute, Alina.
Thanks. And I know you guys have lots of reports to get to, so I'll I'll make sure I don't drone on about systems things. But I think just to pick up on the Kelowna example, because I was obviously very heavily involved there, I think you heard very much that, it's now 2020 that they have their by names list and their work on complex things is just now starting to happen. So I hope you can see how we're also adapting what we learned from those communities and pushing you guys to move on some of these action items while you plan, so that you're not having this kind of sequential approach. You're able to experiment and move quicker, just to your point, Dawn, that we can catch up versus, and leapfrog if we can, versus going, waiting a couple years before we get the money and then setting up and then going. So I think this is exactly on point, that we want to be able to pivot quickly and do what we can as soon as we're mobilizing, rather than wait until we approve the plan, etc. So a couple of bits from me today. The first one, and it's a really quick one, so just a note that we're making some great progress with the health authority and in terms of getting some of the data that we had wanted as part of both our mapping and our financial analysis as well. So a big thank you to Lisa and her team for working hard to get us this data. I think it's going to be really, really beneficial. So that's one quick update. We're going to just do an overview of the community engagement approach in terms of the second set of design labs, and we've again made some great progress today, and today is just to give you an update on what that's looking like moving forward. The integrated coordinated access and the complex needs conversation, we similarly had some work occur between the coalition, the city, and United Way as well. So I'll do my best to represent, but I know we've got folks from those teams on the call that they can chime in at that time as well. And then a bit about the action plan itself. So that's our last big deliverable to you guys, and that's going to be presented to you, obviously as a draft format to the working group. We're going to take it through the design lab process to validate it, but then also bringing it to this group for comments and approval. So I want to make sure that we're all good in terms of our proposed approach to your input at the key parts of the process. So the update on the community engagement that's going to start to ramp up now, that things are a little bit, I don't want to say things are under control, because it seems like we're all blowing up again in terms of COVID, but so far so good, hopefully. We know that we need to do a number of lived experience labs. I think we counted 20 labs that we're aiming to have occur. These are going to be, some of them might be virtual, some of them might be in person. They're going to be smaller groups, conversation groups. They're going to be led by community facilitators, so that they can occur simultaneously in some cases, just because they're targeting different groups. And you can see there the types of folks that we're looking to engage. We're developing the facilitation package, the training, and the kind of coordination of these on the back end. And then it's going to be a flurry of these design labs happening in community during the month of August. So the goal is for us to do the recruitment next week and the preparation of the package next week, and then for the design labs to start occurring thereafter, with the goal of having things wrapped up August 31st for the lived experience design labs. Then we have some of the design labs that we got paused in terms of COVID halfway through some of these. So I'm going to be leading some of them myself, just because they're more systems level discussions. So they're obviously going to bring people together from all over BC, just because we need to engage BC Housing and health as well. So some folks are probably not going to be there in person. So we're going to do a couple of these online, and I'm going to be leading those discussions. And then we've got these 4 that were scheduled last time that had to get canceled. So again, we're going to be leveraging community leaders that are already working in these sectors and have the connections to facilitate those in person where possible, and virtually if it's not doable. So all of this is going to happen in August, so it's going to be a very busy time. I do realize that we're at a different space in terms of our development, so instead of doing the kind of same old, what do you think the problems are, what might be the solutions, which just makes sense upfront in this type of a process, we now have some of the solutions and we have the research that we've already done. So what we're going to do is actually test drive and validate some of the emerging priorities, the proposed ICA model, the complex needs approach, and even some of the implementation governance roles. We're going to develop the material and a presentation that I'm going to either deliver myself in person or deliver via video, so that everybody kind of hears the same messaging in terms of what's being proposed. And then the discussion guide is going to ask different folks for input on those items. So that's the game plan on this piece. We are going to be testing some of the concepts that we talked about, so things like digital navigation, the concept of navigators, these action tables on complex needs. Should we have one on seniors? Should we have one on children and families? What's the Indigenous approach going to be to ensure that lens is embedded throughout? So we really want to ensure that we get some input on these pieces before we, make a recommendation on how you might roll these out. And then same thing around the complex needs table and process. So there might be lived experience groups that are going to include folks that are complex needs. So if you recall, there were 2 of each almost, and that's because we're envisioning some of them might be for folks that have higher levels of need versus somebody that might be, more in need of a prevention approach rather than a more complex needs approach. So we want to run some of these concepts with them, and we're going to, of course, need to make it very visual, very simple to understand. The general public or the folks that might be engaged in lived experience labs are not going to be like you and I, that we've been exposed to this for the last year and have been talking this technical language. We need to translate it into easy to understand visuals and concepts as well. The other piece to pause on, because we've been chatting offline and doing some of the work to kickstart the complex needs interventions and coordination. And again, you heard from Kelowna that they now have a list, but the plan was launched about 2.5 years ago. So we don't want that. We want to be able to leverage their learnings, and it's, again, we all learn as communities as we do this work. So can we introduce some of these coordination aspects sooner rather than later? So as a result of that, we had a conversation with United Way, with the coalition, and started to look at whether it might make sense to dedicate some resources now to a coordinator role for that process, to actually start developing the by name list, the policies and procedures around data sharing, and facilitating some of the work of an already emerging complex needs table that's been spearheaded through the coalition. So Jason and Signe, I don't know if you guys wanted to jump in at this point or whether it makes sense later on, but I'll give you the space and you can decline, and I'll finish my presentation as well. So any thoughts from you guys?
Hi, it's Signe. Can I go ahead, Don?
Let's go, please, yeah.
Okay. Yeah, thanks, Alina. Appreciate that. Just to remind everybody, as a designated community, we have obligations with multiple year funding with Reaching Home to implement coordinated access. And so we had hoped to, this spring, have our recommendations of the task force and be moving forward with implementation, given COVID and everything else, and the extension of the Health and Housing Task Force. We're still obviously all working together on our final recommendations. But in the meantime, we have Reaching Home funds that we must spend before March 31st to 21, particularly around coordinated access. So that's why we're talking now about not holding up the process and actually posting and hiring a contract position, at least for this fiscal, to start moving that work along. And where they will finally land in terms of what are the recommendations of the Health and Housing Task Force in terms of a structure and where we'll embed the coordinated access coordinator. We can determine that and that can be part of the Health and Housing Task Force recommendations. But in the meantime, we can contract somebody. We can be working with the service providers and Dr. Turner in the meantime and start that work and not lose the funding that we've got in for this fiscal. And we obviously have coordinated access funding for the next 3 years ongoing under those Reaching Home contracts. So if we choose, presumably we could hire somebody that can be contracted through that way, or we can figure out how exactly where we want that person to position to report to. But I'm assuming in the short term will probably be through United Way, but with an advisory group through the coalition itself around coordinated access, because we do have a subcommittee specifically assigned to address coordinated access. So anyway, that's kind of the vision, is how do we not lose the funds, how do we move things forward, and in particular from the United Way side, I brought it up, I know, to Lisa and to others, Dawn and Aaron, and obviously to Jason and others. Our community received significant funding under the ECS, the federal ECS funds. We put those calls for proposals out for funding a whole bunch of services, both through COVID, Reaching Home additional dollars and those ECS funds, and some of those new contracted services, which we're just finalizing those contracts for, at least for some of those ECS funds, are for outreach workers that we haven't had before. And they're only being funded for between now and March 31st. And so I would have rather we were at a place where the call for proposal and those grants would have been dictated and aligned specifically to whatever recommendations of the task force. But given we weren't there yet, we put a call for proposal. We've got those grants, and how do we coordinate that increase of frontline workers, in our Aboriginal Center and others who are going to be going out and doing frontline contract or client work with folks with experience, and how do we start collecting data, or at least use this time period between now and March 31st to test out some of our practices around coordinated access. So I'll pass it over to Jason. Jason, any other comments or things that was on that?
Before you go, Signy, Aaron has a question, I think, on your point. Oh, okay, fine. Over to Jason then.
Just Signy summed it up for the most part. We do have a small group that is Coalition, Island Health, and the provider Island Crisis Care of the ERC, that we're just on a coordinated access piece for the beds that are going to be there. So as soon as the working group there, which is very close to finishing and approving the work, that kind of stuff will see the light of day, and then having somebody in place to work with the providers, the people that are delivering the services, to then expand that piece beyond the few beds there and add some of the other housing and other services will be essential. So yeah, we're glad that we're looking at putting somebody in place sooner than later. It'll help the process.
I think Lisa had a question?
Yeah, this is excellent, and Karen did apprise me of the direction this was going. I do notice, Alina, that BC Housing is missing from the complex needs, and given that they have a coordinated access piece, how is that being integrated with this other piece? Are they part of that? Heidi, are you participating with our team, with the health and the shelter and the CMHA piece there?
I can let you know just before Heidi chimes in that we've communicated with BC Housing about that process. They eventually, it'll be nesting into the community process. We're just focusing on one piece right now so that we can scale it up in the future.
Yeah, okay. I would just hate to see a key partner not be part of that, so that's fine. Thank you. So Alina, if you could add that in to the established on the process, and maybe we'll loop in BC Housing on that. Thanks.
Sorry.
Go ahead, Heidi.
Yeah, and thank you for that, Lisa. It's a really key part. And Alina, just so you know, our supportive housing sites are contractually required to use, our database and the coordinated access process. So we see the supportive housing as a small sphere of the coordinated access process and how that can be a bigger piece. But I just really need to highlight that any of the BC Housing funded sites are required to use the supportive housing process, and there is a community placement table in the NIMO.
So could we have an action item then for Heidi to loop in with SIGNY so that we ensure the federal and provincial and island health all line up their processes so that we don't have like 5 different tables? Is that a reasonable ask or consideration?
I think we would like to see that happen, Alina, because it seems to be 2 parallel processes right now, and I'd like to make sure that that's...
As I said before, I mean, I'm not opposed to that as a scenario, but we are already communicating with the people that run that process on behalf of BC Housing to make sure that they aren't parallel. They've been started under different circumstances, and we are working to align them. Staff of many of the people that are at the current working table for the one specific piece are already at that other table and have been there. So we will continue to communicate. If things need to be done more formally, that's great, but they are connected.
And it's Signy here. I have no problem if we can have a chat, Heidi, and look at the draft posting, and we can take a look at who's sitting on the committee and ensure, work with Jason to make sure there's some integration and, that's the intention. We've been working towards this all along, is that we've got the main players active and, in directing whatever our coordinated access system is. So, yeah, if BC Housing isn't already represented on that subcommittee of a coalition, then it'd be great if you could assign somebody to that Housing committee.
Great, appreciate that. Thank you so much.
That's great. That's perfect. We need the funder buy-in. All the funders. Great. Okay. Thanks, everybody. So my last item is just to give you an overview of the actual action plan that we're going to be starting to work on. Obviously, we're validating and developing the content over the next month, because we need to bring this to you guys in September for review and feedback as well. Our 10 review is formally finished in September. I don't know why I put quotation marks. Well, probably because even with Kelowna, I'm still involved informally, so I'm sure we're not going to say goodbye forever. But our table of contents here, this is just to give you an idea of the type of content for you to expect. And then I also thought it might be valuable to just tell you what to expect in terms of the deliverable too, and see if there's any concerns or questions, and then we can rather do it now before we start writing than after we write and like, that's actually not what we wanted. So the action plan overview, we're looking at this as being a 25 to 30 page branded document, so something that looks and feels like Nanaimo. Obviously, it's got to have that community feel, and the audience would be targeted, interested community members and key stakeholders. We would be looking to write it in easy to understand language, but adequate enough in terms of content to convey the proposed strategy moving forward. It would be accompanied by a number of technical reports that bring all the deliverables together that we've been working with you on since the beginning of the year. So the SDA model, the complex needs approach, the emerging priorities would be summarized from what we've heard in the community. We would have the financial modeling work, the needs assessment, which in and of itself is a 20-page document, social impact audit, as well as we finish getting some of the data from BC Housing and Health as well. In terms of the table of contents, so plan overview and approach, and just describing how we got here and why we're here, highlighting the role of task force and key partners in the process, talk about the community engagement and what we heard. We'll summarize the main takeaways and trends from the needs assessment so that people don't need to read the 120 pages, they can get the gist in just a few pages. We'll do some of the guiding principles and key concepts, the strategies themselves and key actions, targets and KPIs to measure, to track success and have some milestones in place. We'll talk about the funding strategy, and now we might obviously not look at Kelowna, they're still working on getting the funding in place, but we can at least highlight what the funding might look like and where we might get some of the funding for implementation. The implementation approach, including the discussion on governance model, and obviously between now and then we're going to need to make some major decisions. I do want to include a section describing the IPA model and the complex needs work, an overview of that, even though, of course, we're going to have more detail in the appendices, but bring this all together in a nice document for you to be able to go to meetings and refer back to over the coming years. I did actually bring the Kelowna plan just to show you, because obviously, as you heard, we developed this as well. The same for them. They had a technical report which included lots of appendices and lots of calculations and data, and that's over here. And then there was a community report, and that was very much a much smaller document, and it was very visual. It also had a 2-page executive summary that just said it all visually with these diagrams, as you can see, and kind of something easy for you to just leave with a minister or a business sector leader that is not going to read. Definitely not the technical document, but also not the community report. So it's just having these communication tools for you so that you're able to do what you need to do in implementing this moving forward as well. So that's the game plan that we've come up with, and I'm obviously all ears in terms of your thoughts on it. I did want to highlight that our goal, and we'll see how things go with our engagement process, because this is happening in August, and it doesn't work for us to develop a plan without the engagement being, at least well underway, so we know we're not missing the mark. But we do have a game plan to have this done either for your September 2nd session or September 16th, and again, that's highly contingent on how the design lab scheduling goes in the community. but for sure, if not the 2nd, the 16th, you guys will have it. Our game plan is to present the draft plan at that meeting and go in depth and make sure that we get all your thoughts and feedback. Then we would go away and take your thoughts from the meeting, and then you guys would also receive, just like you did with the needs assessment, you'd receive the actual draft as a Google Doc, so you can add comments to the actual draft document at any level, minus spelling, because we got copy editors to do that. But if there's any major strategic pieces missing, or the wording is inappropriate or misrepresents, then that's a great opportunity to do that. And the process is going to be virtually identical to how we did the needs assessment review process, but obviously we're not asking you to review 120 pages, we're asking you to review those 30 pages, but it's going to be really important for us to make sure we get that feedback in time. We take that, we make the changes, and we go into design and implement, essentially. So that's why we're also needing to have some discussion about the plan launch as well. So are you going to have a plan launch? Is there anything else that we need to develop for you? Maybe a presentation overview of the plan itself. We need to work on the council socialization of the emerging directions as well. And so we're going to be leaning on the working group to help us figure out the best way to take that on. And we're going to need to start chatting about the transition planning, and which is entwined with our implementation approach. Now, as I say this, I've highlighted this in blue because I feel like that we'll be able to start introducing some of these concepts over in the plan draft, because of course in the plan draft we're going to be talking about some governance and implementation aspects already. So at the September 2nd meeting, we will need to make some decisions about who the task force is recommending is going to be the backbone entity, and at least the big picture governance model as well, so that we can spend September 16th and thinking through in more detail together. So while you have me, I'll try to push you guys into more of the details on implementation, so that just like here's create a new entity or something like in Kelowna, very much the plan highlights the need for an entity, and then they went away and had to do that. But again, if we're able to leverage our time together to start moving into these discussions sooner rather than later, then I'd like to be able to do that. So I don't know, obviously, what you guys are going to do on October 1st, because I probably won't be there, but or I'm happy to be there as well. But that's the game plan for our next three meetings, really. So we got a lot to do. This is the last sprint for this process, and and I'll take any questions though.
Erin has one.
Thanks so much, Nina. Actually, not particular to this, but I'm going to ask you the same question that I asked the reps from Kelowna. So they're 2.5 years into their plan. What roadblocks do you think they're encountering in terms of implementation, and how is that plan either being implemented in the vision that it was written within or not? Like I'm just trying to get a sense of, okay, so we've got this big plan coming, we're all ready, we're all excited, but what are we not potentially seeing? Like what could we get hung up on?
Yeah, and I think I learned a lot from the communities I've worked in, and that's why I've been probably so annoying to you guys, talking about, we need to talk about implementation, we need to talk about governance, we need to have these hard discussions about who's going to do what. So that's going to be the biggest thing, and I think it's already like a bit of a red herring in the 9 as well. Like, what role is the city going to play? What role is the coalition going to play? BC Housing. involved, especially if there's challenges around collaboration and integration of these various efforts that are to be entwined and coordinated. So I think that's going to be your potential Achilles heel if you're not staying on top of it, for sure.
Thank you.
So that, hence focusing on it during planning versus giving you the plan and saying, go forth and prosper and figure it out. Yeah, I think that's a big one. The other one I would say too is thinking about your guys' capacity to implement this and being clear about your needs. You also heard from them they're moving to a $800,000 a year model, but that money is not for implementation. That's for coordinating. So that's not money going into housing first programming, for instance. So that's another risk, right? And Kelowna has a relatively wealthy philanthropic community that can get behind something like that. They have a faith sector that will donate to this kind of an effort. You might not have the luxury of $1 million budget to coordinate data and systems and things like that. You might be only looking at $100,000. So your budget will also be another limitation for you. So that's part of the picture.
Thanks, that was helpful.
Do we have any other questions? I don't see any. So where are we at next?
Reports.
What's that? We're on to reports now. Elena, did you want to stick around for this, or?
Actually, it might be helpful. Oh, you gotta go?
Yeah, sure. Well, I unfortunately have to feed my family, but if it's critical for me to be here, I'll be here for sure.
Just very quickly, just the introduction.
Okay, yeah. And we're now on reports 6A. Go ahead, Lisa.
Okay, so I'll be leaning on Karen Crostel for this one. So the task force might remember that we brought to them a staff report looking at an expression, going forward with an expression of interest for a daytime resource center. And at the time, this is before we had really progressed with the work with Dr. Turner, it was decided to put that on hold, look at the results of this work, and then evaluate where this was needed. Now, obviously, we've had a couple things in terms of we've had COVID, we've had our point-in-time count back in March, giving us an estimate of 425 from that count of those who remain unsheltered. And then we've had other pressures related to COVID that have exacerbated the needs of people on the street, the impact on the business community. And so, and in addition to that, we've also had the announcement of our MOU, which will have some impact in terms of potentially other services that may be relocated as a result. So in terms of food provision in the downtown, those who are homeless. So we wanted to come back when we thought it was timely given conversations with the community. Does this committee want us, prior to this winter coming up, to look at exploring an expression of interest for daytime resource centers? So again, the idea behind this was not to go out with a full RFP, but to go out to our nonprofit community and say, who is out there who could provide with some seed funding that we get annually from council, a daytime resource center type service for those who are unsheltered to go during the day, and come back to the task force and say, okay, these are the options out there. It could be a distributed model, it could be one location, a variety of different options. The expression of interest was kept fairly open for that reason. If that's something you want to look at, we could come back with more of a staff report around that. Do you want it to look at other services as well? So we just wanted to bring that back because it seemed timely with the pressures on the streets right now. So with that, I'll see how you'd like to discuss that and what direction you'd like to give us.
I'll start it off a bit in that right now the city taxes the better part of $100,000 each year for this project. So we have to make a decision whether or not we're going to go forward with it, because we can't keep taxing taxpayers and not using the money for what we tax them for. So that's one of my concerns here is I'm looking to maybe the people at the table here to say, is this an idea that we should be pursuing? What are some of the problems that we might be expecting? What hasn't worked in the past? What would we need to change work in the future? That sort of thing. Go ahead, Dr. Turner.
Thanks, Don. Alina, come on, Don. We've known each other for like a year now. But the only thing that comes to mind for me, because we've had these discussions in other communities, is to make sure that whatever you do, consider that you're going to be serving really complex needs. So just thinking about the space itself being accessible and well staffed as well. So with the right staffing. So if that's something that's on the table, I don't know what kind of budget you guys are looking for. These things could be expensive. I've seen them run about $1 million annual budgets. Now it doesn't have to be only one entity either. I've seen them where they actually bring together different community nonprofits and public systems. So then it almost becomes like a one-stop shop is what it's, or opportunity center. I've heard it called that before too. And that's also where you can house your coordinated access staffing too, so that you can kind of marry a couple of functions in out of the same site. And it's not necessarily one size fits all, because you guys' model is absolutely looking at complex needs, and I think this might do the trick for that street level population that has nowhere to go. But you could have this along with more decentralized models that might leverage community buildings and libraries for more of that digital navigation that we talked about before. So I've seen it work really nicely as part of an integrated approach, depending on community needs. So just that consideration, but I'm sure other folks have similar thoughts and ideas as well.
Anybody want to jump in? Go ahead.
Well,
Go
Go ahead,
Sid Zegnan?
Yeah, just given that we had that great presentation around what's happening around coordinated access in other communities, I guess it would be worth our while if we're going to investigate this, is to look at what's it costing other communities, what have they learned, like Victoria and other places. And I know city staff have done a lot of that and gone down and reviewed or toured places. I think this isn't current information, but I remember at least a year ago, one of the concerns that I heard from the various nonprofit service providers was the concern that there'd be a contract put out there, one agency would be hired to implement the service, and if there wasn't significant resources integrated into it from Island Health and other funders, my understanding, at least that year ago, was that any individual nonprofit wasn't going to be able to, just with a single contract, be able to address the needs and really, take this on in a healthier or more comprehensive way that would support the business community and others who are facing the pressure. So I'm just speaking what I heard from the nonprofit sector, which was great idea. And Alina, you just said, budget of $1 million a year at least for some models. So I guess the question is, have we got $1 million a year? And do we have agreements, or how do we move forward to getting agreements with Island Health Resources and others, so that we've learned from best practices elsewhere? And I'm not a direct service provider, so I'm just speaking from what I'm hearing from the other BC 13 communities that have Reaching Home funds, some of which have frontline services like that, and others which have not.
Lisa?
So I'm going to jump in, Signe. We do know that in order for something, we've had estimates of upwards of 800 to 900,000 per year, which is close to that $1 million range to do this adequately. One of the things with the EOI is the option for an organization or a collaborative or collective to come up with a partnership and funding model using seed funding from the city. You know, the main thing is I actually don't want to take too much time because we do have a decision on a red bag report, but is this something you want us to look into further or wait? Because part of the problem is we do have winter trucking up against us in part, and we know that we are going to be struggling for shelter space. So
if I may, my sense is, yes, this would be wonderful. It would be great to know who in the community might be interested and have the capacity, but without an awareness of how much it's going to cost, who's going to pay for it, how it's going to operate, we're kind of chasing things. And I feel that with Alina's work coming down the pipe, we're going to have a lot on our hands. This might be, this might push us over that place where we feel like we're still embracing change.
okay.
Yeah. That would be my
So what does that mean?
Oh, I would suggest that it's not the right time for this. Yeah.
Okay.
But that's just me.
Well, no, I would like to hear other folks. Let's just spend a couple more minutes. Kim, do you have any ideas? Go ahead.
I don't know if I have any ideas. I think that we need to proceed with coming up with a plan, or at least getting an expression of interest, or at least exploring or researching potential ways to proceed on this, and different costs at different tiers of doing it. The situation currently on our streets is drastic. I counted a dozen shops closed today between Old City Quarter and Commercial Street. I think my count was at 7 last week. So we're losing businesses weekly. We have a lot of wanderers on our streets, simply have nowhere to go, so they just make circles. And to provide them with some additional care. As you know, downtown all too well, the Wesley Street Tent City is growing and expanding up onto down Robson and up Franklin. So I think that we really need to think about this as an option. I think it's a shame that when this first came down and the first $100,000 was granted, there was really no idea of what $100,000 would do or what it wouldn't do. So it was kind of a moot decision in the first place, in my humble opinion. But I think it needs further exploration. I think it should be explored in parallel to what we're doing. And then as the results of our research comes in, we can modify that according to what we're learning through these other processes. You said, what would be the downsides? Well, the downside right off the get-go is going to be NIMBYism. Try to find a location for that and something that's suitable when everybody is already, running around with their hair on fire because of centralizing services close to downtown, but where the heck else would you put it? So, anyway, those are my 2 comments.
Okay, thank you. Heidi, I was wondering if you had some opinions on this.
Well, Heidi, you're on mute.
I'm sorry, I missed the question.
Well, we're talking about the daytime resource center, and I was wondering what in your capacity, what was your ideas or opinions on such a beast?
Yeah, and it's such a difficult one. So BC Housing recognizes that there is a need for daytime programs. It isn't anything that we have funded. We have the One Drop-In Center in Victoria where we do provide a contribution to that. It's been the same amount for the last actually since the day it opened. Up and down the island, they're funded through different ways, but I can definitely see the need and hear the need within numerous communities for that daytime check-in connection place. I don't know what else to say to that other than we acknowledge the need. It's not something that BC Housing funds. We want to fund permanent housing solutions for folks, or we also recognize there continues to still be a need for the shelter opportunity and to be able to connect. Our funding also includes outreach workers to really meet people where they're at.
Okay, thank you. And if I could ask the other folks that might be involved in this is Lisa Murphy from Island Health. Do you have some opinions on a daycare center? And you're on mute too if you're talking.
Muted. Thanks. Sorry, I can't control the mute on my end. I think I was involved in those discussions before, probably not unlike Heidi, see such benefit in a service like that. I guess where I'm getting stuck at this point, and it probably follows the conversations about Wesley Street and the pressures. I've been working with our manager, Amanda, around what she's learning. This feels like an additional piece, kind of probably lining up with what Erin said. I'm failing to see how I see how it would help. I see it almost as secondary to finding a better location for what's happening on Wesley Street. So for me, it's a both and I could be missing something in how it was described. I guess where my mind goes is if people don't have some sort of place to go, won't we create a congregation around a daytime center, but perhaps missing something.
Jason, I see you're videoed up. Did you want to add something?
I figured you were coming to me next, actually. But anyway, most people have encapsulated it well. I mean, on my side of things and in many discussions with colleagues, we absolutely support a service like that. I think it would be one of the things that could be offered to people, and I don't think it should be, completely thrown away. But I think going right back to where Alina started, the folks that people are worrying about right now for something like this are the people that you are seeing out the city's back door on Wesley Street. There is very high acuity. These are people with high and complex needs that we would be doing probably disservice to all the things we are trying to achieve in the community to do this in a reactionary manner. It would become a lightning rod, and especially if we did not fund it properly to be able to hire the level of staff that we would need for something like that, it could do harm. And that, I think it just goes back to this focus on, we need so many things throughout this continuum, and the part of this process that I'm loving and that we are all going to appreciate in the end is getting the data and getting the big picture, because we need so many things across the continuum, but it seems that the conversation always comes back to those that are creating the disorder, which is a much smaller group, and it does not paint the picture of homelessness. So when we kind of come up with these more reactionary, potentially responses and without proper funding, because I don't know of any of the other nonprofits that have spare hundreds of thousands of dollars or even $50,000 on an annual basis to put together for something like this. It just takes the focus off, and I'm not trying to downplay that issue. That issue is huge, but when we're talking about the wide range of homelessness, I'm more concerned about the woman that died on the streets this week, when we've been trying to, that's really, really vulnerable, that has had her own complex issues that we weren't able to house because we had nowhere to put her, even though we had her on lists and we kept advocating for her. People like that die weekly, and we continue to focus on those that, yes, are causing disorder, but I just, taking us down this road where that's the only picture of homelessness, and that's our only response is really, really difficult for me. So yeah, I think it's something that should be still explored in the future, because it might be the right thing to do and the right place to invest money in the years leading up to having enough housing. That might be part of the solution, just like a low barrier shelter might be, or something like that. But I don't think we rashly jump into something that will quite clearly stick a lightning rod in the ground for our community.
Okay, and Dr. Alina.
Yeah, I think you nailed something really important there, Jason, that, and even going back to let's just talk money and financials and targets and things like that. Sometimes, putting things in numbers sometimes gets us there faster, but if you remember the financial modeling when we looked at what's going to actually end homelessness in the NIMO, it was housing. And if you saw all the needs in the community and all the backlog in the system was permanent supportive housing and housing first, rent supplements, all of those permanent solutions that Heidi mentioned. So I don't disagree that this could be part of the continuum. I really don't. Like I said, there's lots of communities that have invested in it. If I only had $1 million, though, I would put it into supportive housing or housing and support, not necessarily in another entryway into a system that has no back door. But the problem is that there's no back door in the NIMO. There's nowhere to refer people to. And I think communities, it's easy to invest in these front door opportunities, but they're just going to become another hamster wheel if there's nowhere for people to go from there. So just a note that I've seen that happen a lot, unfortunately.
Lisa, just sum up.
I guess I just want to raise a point, and I'm just wondering if we don't use this money, it won't be carried forward. And so it has to be budgeted every year by council. So is there, and I'm asking a question that is probably ledged in the bill, of course, and the other, is there are many ways to address what we're trying to do. Is there another way to look at this funding being used? I don't know the answer.
That is such a big conversation.
Okay, so maybe we'll leave it for now. What I mean is,
Right.
is the understanding that this isn't going to keep carrying forward.
Okay,
Yeah.
I'm going to suggest we leave this topic. We're just going to leave it, right?
Yeah,
All right.
that's right.
We'll be addressing it later. We do need to make a decision on the rent bank. So let's move on to 6D and also accepting the correspondence that came along with that as well.
Okay. So if I could introduce that briefly,
Sure.
I'm going to turn this over to Dave Stewart, who's one of our social planners who's been working to get this landed with also the homelessness coalition get feedback. So I'm going to let him carry the day on this, so he has a bit of time. But you'll remember we did raise the rent bank and the fact that we'd be working on this, and we went to the coalition with it. So Dave, if you could perhaps take it away. Thanks. Okay. Do we have a quorum still?
We do.
We do. And unfortunately, Councillor Hemmons has to leave right now, so everybody wish her a happy birthday because of her.
Oh, yay!
Happy birthday.
We are over time.
We are over time, I'm going to ask if people could stay.
If people can stay just for a short period of time, we just have to have a vote on this and then we can run. Go ahead.
Okay, thank you. So yeah, appreciating that we're over time, I'm just going to provide a very short overview of rent banks. Some of you may remember we talked about this in December, where we had a presentation from Melissa from BC Rent Bank. But just a brief overview, basically what a rent bank is, it's a housing stabilization tool, or a homeless prevention tool is another way to look at it. What it is it's a program that offers loans geared to low-income residents, generally either no interest or very low interest, and extremely forgivable loans. So since that meeting in December, I don't know where to look.
Just
The
talk.
camera will see there.
Yeah, thank you. Since that meeting in December, we've met with BC Rent Bank. We've also met with the Nanaimo Homeless Coalition. BC Rent Bank's also put out an expression of interest to support a rent bank through the BC Rent Bank network. And what that would include is in-kind support, which is really valuable in terms of experience from other rent banks that have operating in the last 15 years in BC, as well as some financial support as well. What that amount is, we're not clear because we're just still in the expression of interest piece. Through the Nanaimo Homeless Coalition, we worked and we selected a lead operator, which would be the John Howard Society, to operate the rent bank. The reason we did that is BC Rent Bank has asked for a lead operator to submit the application process, so John Howard's worked with the city in doing that. The good news I can share with you is we are, through that EOI process, we have been selected to go to phase 2. Any public announcement, however, won't be coming out until September, so this is really, we are still in the process, but things are moving along in a really positive way. So that being said, one of the reasons I'm here is through that process, the BC Rent Bank asks the communities to provide additional funding to support it in a sustainable way. So when we sat down and looked at what we could bring to the table, we looked at the Housing Legacy Reserve Fund, and through that Housing Legacy Reserve Fund, there's a small piece called, that comes through our OAP, which is the online accommodation taxes that we get through short-term rentals. And within the last year, we got $90,000 through that. So we thought that was a really good fit for the rent bank to help provide some sustainable funding to get this program not only started, but hopefully to carry it on through the years. So what we're asking today is a recommendation from the Health and Housing Task Force to recommend the council support us in allocating those funds from the OAP towards the rent bank.
Okay. Thank you very much for that. Does anybody have any questions?
I'll make the motion.
Okay, thank you. Signe has made the motion. I'm looking for a seconder. Kim, were you willing to second it? Thank you very much, sir. No other discussion? In that case, I would call the question. All those in favor, raise your hands and say aye.
Aye.
Any opposed? Thank you. Everybody is opposed. That's passed. I'll pitch it to council with my hardest heart. So now we're on to number 7. It's other business. I'm going to suggest we also move this one along to the next meeting, and at which point we're now at the adjournment. I was going to have everybody sing, but we're not going to do that anymore because they're enough. Kim, you have a question? Oh, your motion to...
Moving adjournment.
Oh, moving adjournment. Thank you very much. Jason, you're seconding, right? Yes, thank you. Okay, all those in favor say aye or raise your hands. And thank you very much for everybody for participating. We'll see you next time. Okay.
Thanks.
Good job.
Goodbye.
Thanks, Dave.
Thank you, Dave. I'm sorry you only got